Welcome to the workshop on healing trauma with psilocybin, and we're looking at part 2 today. In part 2, we will be having more details on how to manage psychological distress. And let me just let our co-host in. So in the first workshop that we did, we covered a lot about the diagnosis of post-traumatic stress disorder. And we also talked about administration sessions for people with trauma and some of the research on PTSD. So that part 1 video is on our Bodhi Academy YouTube channel. And in part 2 today, we're going to review some of that information for those of you who haven't watched that content. And then we're also going to go more deeply into how to manage psychological distress with trauma survivors or trauma clients in administration sessions. So we're going to talk about a couple of different models of care that are important to know about. We're going to talk about cultivating the right mindset, which is very important, and special considerations there for folks who are coming to the session to try to heal post-traumatic stress. We'll talk about those administration session considerations and things you need to have in mind. We'll also be talking about psychological distress. What happens? What does that look like? What is the best response to that? And understanding how to intervene and the right attitude to take with someone who's under the influence of a psychedelic and also having psychological distress during their experience. And then we'll follow up with integration considerations for people with trauma, and especially for people if they had, psychological distress during their session. They have special integration needs. So we'll start with the models of care. We're going to look at 2 different kinds of approaches. We'll look at the clinical, therapeutic, clinical research-based model, and then we'll look at a more expansive consciousness-based approach. So here's the kind of highlights on the clinical model of care for psilocybin-assisted PTSD recovery. So it starts with a comprehensive evaluation, finding out the background of your client, their psychological background, their medical information, relationship issues, if any. You want to find out, if they are in a safe place before they start the experience, and if they have a safe place to go back to. You want to get an idea of what exactly they're looking to address with the session. What sort of symptoms are they having? What is the, really I try to focus on with our clients, what is the most distressing component of the trauma response that they're having that they really want to get resolution for. And then getting informed consent is really critical, especially around the topic of supportive touch or physical touch. We want to be sure that those lines are drawn very clearly and that the client is an active participant in determining and defining how physical touch will work. Informed consent also includes important information about how we approach this work as guides and facilitators, because the client is an adult, 21 years of age or older, who chooses voluntarily to have a psilocybin experience and is seeking professional trained support for that experience. So you're providing services, but it is the client's experience, and they take responsibility for their experience, for their carrying out any advice that you might give them or any suggestions you might make. And it makes it clear, that everything is in their own hands. They can make their own choices every step of the way. Informed consent is a very comprehensive document, and it's featured in our full training. Obviously, a lot of this is featured in our full training, but you'll get a little sense of it from our conversation today. And then we move into preparation, where the client is supported to make a plan for their session and set their intentions and find out what goals they want to reach with this session, and really to help the guide or facilitator assess their mindset. Now, coming up in a minute, we're going to talk about cultivating the right mindset, especially with folks that are struggling with post-traumatic stress. So preparation planning is a very important part of all models. You know, of course, the consciousness-based model is going to use all of these same methods for supporting a client in a professional setting. We want to have a safe and controlled environment. We want to make sure that the furnishings are comfortable, the room doesn't have any distressing, triggering items or objects in it. We want to make sure that the client feels comfortable there, they have everything they need, and that we can ensure privacy, and preferably with clients with trauma, access to the outdoors, because sometimes, depending on the nature of the trauma, people might feel a little more grounded, a little more calm if they can be outside in nature looking at the trees and hearing the birds, than they might feel in a contained room. On the other hand, some trauma survivors prefer to be in that contained room, makes them feel a little bit safer. So it's, again, client's choice and what is appropriate for each individual. The facilitators or guides for the session should have the right training. They should have in-depth training in harm reduction, methods, techniques, strategies, and tools. They should have training in trauma-informed communication and trauma-informed organizational considerations, including their policies and their staff and anybody else that might work with you. They all need to have training in trauma-informed methods. We want to make sure that the client receives advice about what might be the most appropriate and effective dosage for them with psilocybin. How much should they take? What, based on all of the information gathered through their screening, their evaluation, their preparation. Determining dosage is another topic that we spend quite a bit of time on, but just briefly, it has to do with their history of psychedelic use, and their intentions, as well as any medications that they might be on or might have recently stopped that could interfere with the effects of the psilocybin. So we take a lot of things into account when suggesting the dose, including if the client's going to have more than one session. Important to keep in mind that in the clinical research studies, they actually always do 2 sessions with people. They never just have one session. And the first session is a lower dose and the second session is a higher dose. So if a person's going to take a second dose within 2 to 4 weeks, then they will need to have a higher dose the second time, because the body adapts to psilocybin and we get tolerance for it. And so we have to offset that with a higher dose the next time. That supportive presence that the guide or facilitator provides is really critical for people with trauma. Or really for anyone, but oftentimes for us, we always use co-facilitators. The clinical studies also use co-facilitators. Having 2 people really provides extra safety net, makes it easier to intervene in psychological distress or to carry out de-escalation if it's needed. And the clients really appreciate having 2 facilitators as well. It also allows for each guide or facilitator to take a break because it's a long day, it's a long session. It can be 6 to 8 hours. There's sometimes certain strains and certain dose levels where it might be 9 hours. So you want to be sure to have a co-facilitator, um, or think about having a co-facilitator when you're working with somebody with trauma. It's really good for guide and facilitator self-care to be able to take that break, step out of the room, have some lunch, go outside for a minute, and of course for restroom breaks. But we want to avoid leaving the client alone um, at all times as to the greatest extent possible. We want to then provide an initial debriefing for the client at the end, meaning when they come out of the experience and they're in the later stages, we want to be very mindful of their suggestibility and vulnerability. And we really want to wait until they're in the final phase of the experience where they're coming back to earth. And then we want to offer them the opportunity to talk about what they experienced or what they remember. And keeping in mind, many people are not really ready to talk about what happened just yet. They're not able to put this kind of big, ineffable, beyond language experience into words. And that can take a few days. So we'll talk about that also in the integration piece coming up. They could attend and benefit from both individual and group integration sessions. It's great to have a community of people who are peers. In other words, they've all suffered some sort of trauma. They're all dealing with the after effects of post-traumatic stress. And, they need a private session for sure, and they need private individual integration support. But it can also be useful for them to attend like an integration circle with other people who are seeking to recover from PTSD using psilocybin. And then once they have completed their experience, whether it was one experience or two experiences, we want to assess and adjust their treatment plan. So we might say, well, you got a lot out of those two sessions, and maybe we want to revisit another session again in the future. Maybe they don't need as intensive support as they had ahead of time because they likely will have resolved quite a bit of, aspects of their trauma. Now, not to say that psilocybin is the cure or the end of the process. There's the integration process is really where the big changes take place within the individual and in their environment and how they want to show up going forward. When we look at a model from the perspective of depth coaching and consciousness, we add quite a few things into the mix. So we use techniques around dialogue and inquiry, meaning we're having conscious conversation. And it's really important to know that depth coaching, transpersonal strategies, psychosynthesis, self-actualization, these kinds of philosophies really most support a psychedelic experience. So dialogue and inquiry is open-ended and meaningful and offering lots of opportunities for the client to go deep within themselves and find their own answers. We refer to coaching as really the ideal method because for harm reduction purposes and out of respect for supported adult use, we are always non-directive and client-centered. So we're not telling them what to do or how to do it. We're simply supporting their own inner knowing and empowering their inner healer. Mindfulness and meditation can be very helpful in preparation as well as in the integration process. Anything that we can teach the client ahead of time can help them more successfully and comfortably navigate the actual psychedelic experience. We want to be sure that they learn strategies, and so we teach a lot of different preparation techniques, integration techniques, and methods, and provide a lot of tools in our program for guides and facilitators to be able to help their clients go to the depth that they need to go to and get what they are coming to the medicine for. Keeping a personal journal is really critical, especially ahead of time, reflecting on intentions, reflecting on purpose, your purpose in being there, but also having a place to go with any concerns or fears that might come up. It's really important to have a personal journal. We always tell people when you start the preparation process, maybe you want to get a special journal for this particular unique experience, and have that journal with you during your administration session and then return to it again at the end of the session. Guiding people in breathing and grounding exercises as a part of preparation is also critically important. Think about if they go into an episode of psychological distress or dissociation during an administration session, it's going to help a lot if they already know those breathing and grounding techniques, and you'll be able to get them focused on that and help them actually do those techniques during their psychedelic experience. But if they're already under the influence of a psychedelic and they've never done anything like that, it's going to not be possible for them to be able to do that or follow your instructions when they are under the influence. So we want to be sure that we set a good foundation where the client has a lot of experience and techniques to go to during their session. We provide a lot of client education, and education ahead of the session is really critical because if we think back to the beginning of psychedelic experiments, where the early research in the 60s, they didn't tell people what's likely to happen or what effects you might experience or how long each phase of the experience will last or what is happening in each phase of the experience. And so we want to be sure that they have education about what's going to happen, because that is a big factor in reducing the risk of psychological harm by getting caught off guard with this incredibly powerful experience and they had no idea what was happening. So we like our clients to be well educated about the psychedelic experience, as well as learning some navigation skills they can use that will benefit them during the experience. But we also want to introduce a concept to them about their inner healing intelligence, their higher self or their inner self or their inner genius, or these kinds of concepts that point to a more of a transcendental self, a self that is unaffected by the things that the emotional nature is experiencing or the psychological level of the individual. So the idea of a greater self or an unaffected self who can be in a transcendent state of awareness is very, very good information for clients to have ahead of time and to be thinking about. Can I access that self with the psychedelics? Setting meaningful intentions is also really important. Research, clinical studies show that people who come to a psychedelic experience without really having a purpose or an intention and just saying, I just want to see what happens, I just want to see what it's like, they are at greater risk of psychological harm. So to reduce the risk of psychological harm, we help people with depth coaching strategies to really go inward and find their most important, most meaningful intentions for the experience. And that gives them a focal point to contemplate ahead of their session, as well as having that to go to during the session and after the session. We are big on ceremony. Ceremony is something that speaks to the subconscious mind and really kind of marks this moment as something very special and important and healing is about to happen. And then, of course, that supportive presence of the guide, always reassuring and comforting and attending to needs. We'll talk about that more when we get to the administration session. On the other side, during the integration process, when we're doing things from a consciousness based depth coaching perspective, we're helping clients to interpret symbols that came during their experience, making meaning out of what their realizations and insights were about, and exploring the dreams that they may have had or may be having after their experience ends. So, interpreting symbols doesn't mean that they say, the client says, oh, I saw a horse, and then the guide or facilitator says, oh, that could mean this. We never say what anything means. We guide the client by using coaching strategies that are non-directive, client-centered, so that they can figure out what that symbol means to them or what that dream means to them. We would never want to disempower the client, especially at any point in the process, but during the experience and after the experience, their consciousness is very porous. They're very open, they're highly suggestible, they're very vulnerable, and we don't want to give them any imprints or any kind of conditioning or programming. We want them to have the safety and the support and the freedom to explore what happened in their own way and come to their own understanding of their experience. We use techniques that involve creative expression, so we might, offer them the opportunity to engage in art, or which could be many different mediums, sculptures, or chalk, or craft projects. Or movement as well, or singing or chanting, or there's many elements to integration. I believe our training program probably offers far more integration options and training in so many different methods, compared to, just the standard of knowing what questions to ask. We include that, but we include a lot more. And then integration exercises, which are little tasks, techniques, and practices that the client will engage in as a part of their integration exercises. And with the consciousness-based approach, we're always looking at the whole person, every aspect of the client's being. So their emotional integration, mental, intellectual integration, physical integration or somatic integration, their consciousness integration, or we could call it their spiritual level integration, especially with the potentials this medicine has for big mystical experiences. We also want to have in mind their life, right? So integrating their new understandings of who they are into their important relationships, and integrating into their lifestyle all of the new strategies that they developed around how I want to show up, how I want to live, things I want to incorporate that I haven't done. Maybe they want to start a yoga practice. Maybe they want to have ability to join different kinds of community. So we're always looking at every aspect of the client throughout the entire experience. Obviously, mindset is really important. So we know harm reduction in psychedelics, there's five main factors. The first one is the set, and that means the mindset the client is in when they come to the experience, and then the setting where they having the experience and what are the elements of that setting going to be, and then the guide, who is the guide and what bond do they have with them, and how have they built that relationship, and what skills and strategies does that guide bring, and then the dose is also an important consideration. So I was right the first time, it's 4, but all of those things are important. And the guide or facilitator is really responsible to help the client or participant to be able to cultivate the right mindset, figure out what setting is best for them, participate in all of the elements of preparing, going through the experience and integrating the experience, and then understanding the right dose. But on this slide, I just really wanted to focus in on the mindset, because clients who have post-traumatic stress can present unique challenges. So they have different adaptations to their trauma that are helping them and helping them feel safe and helping them navigate from the point of view of having an overactive autonomic nervous system that gets triggered. So they can present with issues that will directly affect the mindset. If a person comes to a psychedelic experience with the idea that I want to be in control, they're going to get in trouble right away, because the psychedelic experience cannot be controlled by anyone, anybody taking it. The psilocybin will create the experience. It'll create the flow of consciousness. It'll present whatever it presents, and every individual's experience is unique, and every journey is unique for the same individual as well. So when we're getting people ready, we want to assess their tendencies and where they're at. So these are some of the things here on the left that we see frequently with people with PTSD: over control, fear, avoidance, trust issues, resistance, anxiety, attachment to a diagnosis identity. I'll come back to that one in a minute. Any co-occurring disorders they might have, substance use issues, or if they're taking psychiatric medications, and where are they at with their boundary issues. So obviously a lot of these things are things that we're finding out about through the initial comprehensive evaluation process and through the course of working with the client and getting to know them. That diagnosis identity is a critical factor, because, you know, we've introduced this idea of the transcendental self. So there's the ego self that struggles and suffers and carries the memories and the pain of the trauma, and also the psyche and the mind and the nervous system that have adapted to carrying that amount of high levels of stress. But that is not who they really are. But people will start to identify with their symptoms and with their diagnoses quite easily. You know, so I'm a trauma victim, I'm a trauma survivor, or I'm a survivor of childhood abuse, or I'm depressed, I'm a depressed person, I'm an anxious person. We want to make sure that they're able to consider the possibility that that's not who you are, that's something that happened to you, and put them on this more open quest, in a way, for their true, authentic, enduring, eternal, transcendental self. Yeah, so that's very important topic. But if they're too controlling, you're going to have to give them extra time and preparation and help them practice strategies that allow them to actually experience letting go of control. And sometimes this might be something like having them take a microdose and have a sound healing session, or engaging them in holotropic breath work, or other things that are not psychedelic, where they can experience and practice letting go. Surrender and letting go of control are the two most important factors in having the right mindset. So you can understand that it may take additional preparation sessions. So we want to be sure in the screening process that we evaluate medications, substance use, co-occurring disorders, because all of those can be signs that additional support is needed, additional time is needed for preparation before undertaking the actual psychedelic session. We want to always maintain unconditional positive regard with all of our clients, including our clients who are struggling with trauma. They may feel very marginalized, isolated. They may have these strategies of, pushing back or having rigid boundaries or not having boundaries at all. But we're not there to judge them. We're there to support them. And we do that through unconditional positive regard. And we teach quite a bit of content about that in the training as well. The alliance between the facilitator and client should be based on safety, trust, and attunement. So we're always attuning to how that client's responding in every moment. But we're also needing to attune with ourselves and seeing, am I having countertransference or am I reacting to the client's transference issues? And be sure that you explain and go over that informed consent document with the client thoroughly before you even get started. Discussing the use of supportive touch and securing consent for that is a part of helping them get in the right mindset. All of these things are designed to help the client already feel safe and already feel like they're with a trusted individual before they get to that session. And we want to empower them to advocate for their own needs. So again, some people adapt to trauma by withdrawing and kind of letting other people take the lead. So if a client is very passive, we might need to give them a little bit of extra support ahead of time for them to become comfortable with speaking out about what they actually want and need. Providing education, so that they don't get caught by surprise with anything. We use a variety of assessment, self-evaluation, and coaching tools with a lot of our clients, and that includes a self-care evaluation, boundaries evaluation, exploration of values, and information and exploration of the idea of that inner self. We want to make sure that their preparation is comprehensive, whatever that takes, however long that takes, so that we talk about boundaries, triggers, if they potentially encounter psychological distress, how will we handle that? If they have emotional or behavioral escalations, how is that going to be handled? If we have this conversation ahead of time, it's going to be much easier to help the client move through challenges if they already understand what we have set up as this is how we're going to deal with it. Teaching navigation skills to the client to help them, move through anxiety and resistance, helping them fine-tune their intentions to make sure that they're really getting to their deeper needs and something that's really important and meaningful to them, and encouraging them to practice surrender and letting go before they get to the experience where now they have to do it. And understanding challenges that they might have with trust and providing additional time, additional preparation sessions to help them feel more confident and more trusting. Of course, as we always say, the most important thing is to trust the medicine, trust the psychedelic experience, and trust your own inner self. Here's just a broad overview of considerations for the actual psychedelic session. Facilitation skills that you're going to bring to the table here are methods and tools and techniques to prevent or manage overwhelm and dissociation. Methods and techniques and strategies to help the client navigate anxiety or overcome resistance. Providing reminders during the session about the navigation skills that they learned in their education session. And providing supportive touch, but also recognizing that consent can change during an experience. They might have said ahead of time, yeah, it's okay, you can hold my hand. But during the session, they might feel more like, don't touch me, I don't want to be touched. So we need to know that consent is fluid. And if they consented and in the beginning of the session when they were nervous or anxious, they wanted to hold your hand, but now they're deep in the experience and they don't want to be disturbed. So we always respect whatever the client actually says they want or need. And we learn to read their body language, and we learn how to offer touch before we offer it. You never just touch a client without going through the right steps. Managing psychological distress, which we're going to talk about next in depth, but we want to keep in mind that we're going to intervene in any kind of emotional distress early. And this doesn't mean, if a client is crying and crying and crying, we don't necessarily have to do anything. That's not a symptom of needing intervention. If they're more, having hyperventilation, they're starting to panic, they're getting restless or standing up or moving around, then those are more indicators that they're getting overwhelmed and we need to intervene. Making the plan to have a co-facilitator is critical, and having a backup guide on call. We like for our backup guide to be on site. They don't have to be in the administration session, but they have to be on site in the event that something escalates and we need more support for a de-escalation. The guide will be providing reassurance if distress is happening, an embodied present, you're fully present, you're only there for that purpose, and your demeanor is very calm. When the client escalates, we do not, because if we escalate at the same time, it's going to make their escalation worse. Using supportive touch if appropriate. And sometimes if a client's escalated, they don't want to be touched. Other times, just having that hand on the shoulder, reminding them that they're not alone is something that's beneficial. And allowing silence, when someone is having, riding a big wave in the psychedelic experience, we don't always have to say anything. We can offer a few ideas or suggestions, but then we need to be quiet. Allowing time to pass is also critical because the psychedelic experience is finite. It's going to end. It's going to go through known, predictable stages that last varying lengths of time. And we know that by checking the clock, okay, there's only one more hour and they're going to come into plateau, or they're just in the peak experience now and they have a few more hours to go. But allowing time to pass often is the best strategy for any kind of distress. The psychedelic experience is dynamic, it's always changing. So even if they're in a moment that's really challenging and really distressing, it will change. It's not going to stay the same. And the facilitator has to be the one to keep that in mind. So sitting back, being silent, giving space, and knowing that the time will pass. The right setting is a critical thing for trauma. We want to not have triggers in the room. That might mean, looking around for artwork that might be distressing or strange, book titles that might be triggering, sculptures, or any kind of spiral patterns or alternating colored patterns in the room are going to be very disorienting. So we want to eliminate those things in our space, and eliminating noise pollution. So not holding a session for someone with trauma in a building that's, a short distance from a hospital where ambulance sirens are happening, or a police station where sirens are at. Sirens are really distressing during a journey, and we don't want noise. The room needs to be really quiet, even if the client is using a headset, which we recommend, and listening to a psychedelic playlist, which is helpful. Their hearing becomes so acute, all senses become so acute in the experience that even if you quietly open a door or whisper to your co-facilitator, they can hear it. So we want to really have a quiet space. A comfortable area with comfortable furniture. We encourage the client to bring comfort items, things that help them feel better, a special blanket, a pillow, sometimes a stuffed animal, whatever it is for them. And encouraging them to create an altar or a focal point where they can put their objects that represent their intentions. Clients bring all kinds of things. They might bring a seashell, a certain rock, a little plant, photos of loved ones. So we want to have that place ready for them ahead of time to really be able to narrow in and remember why they're there. Let's talk about psychological distress that might happen during the session. Any kind of non-specific symptoms of stress, anxiety, panic, fear, or grief or depression. Now, keeping in mind, grief coming out during the session can actually be very therapeutic and healing. But if a person at sort of coming out the end of the journey is depressed or having a lot of grief or having suicidal thoughts, that's something that we need to provide extra care around. Higher levels of psychological distress indicate impaired mental health, and it can be temporary, situational, or triggered by external stimuli or internal stimuli in terms of the psychedelic experience. So maybe they saw a flash of a traumatic memory, or maybe they saw a deceased family member who had mistreated them. There are lots of things that can happen in a psychedelic experience that could trigger them into a state of psychological distress. Higher levels of psychological distress could be happening because of common mental or emotional imbalances like depression, anxiety disorders, and certainly trauma. You know ahead of time, this client may be more prone to episodes of psychological distress. And that can be expressed in many ways in their physical reactions as well as their emotional experiences or internal self-talk. So it can show up in a lot of different ways. It could be anger, it could be rage, it could be extreme fear, paranoia, panic. These things can happen. But when the client is distressed, the guide or facilitator becomes very calm. Oops. So let me go into how do we respond to psychological distress? Obviously, this is a big topic, and it's something that we spend a great deal of content in the training program and in the live scenario role plays, helping our guides and facilitators to master. But these are some important tips to keep in mind. Even though it's not easy to do this in the most severe situations, the most important thing you have to do is stay calm and clear-headed and be grounded yourself. Psychedelics make people hyper aware of the energy field and the emotions that that other people are feeling, or even other thoughts. There's a whole line of study on what's called interpsychic transmission that happens during psychedelic experiences. So you must be the source of groundedness and presence and not be escalating yourself. Don't try to force any particular action or reaction on onto the person who's experiencing the distress. Let them be where they are. Make it okay for them to feel what they're feeling. So we're not trying to talk them down like they used to say back in the early days of psychedelics, talk them down. We're not trying to talk them down. The experience might be distressing because of something that's happened in their journey, like remembering that trauma or realizing finally how bad something really was. And that's the beginning of healing. Whatever happens during the journey that is extremely distressing is going to be very important for them in integration. And oftentimes people who have the chance to process and integrate a psychologically distressing experience, really get the most benefit from those aspects of the experience. So psychological distress is not a sign of a bad trip or a traumatic trip. It's just a wave of experience that has happened in the session that is challenging and emotional. It is not a traumatic trip. A traumatic trip is where it's all really more likely to happen if you are not properly prepared, you're in the wrong setting, you don't have the right help. Then you're more at risk of what we call a traumatic trip rather than a bad trip. And so wild things can happen, and you had no idea they were going to happen, and so it is traumatic. And people can get PTSD from those kinds of experiences. In our training program, we go very deep into how to prevent that, or if it's starting to happen, how to stop it, including the opportunity for you to learn about herbs and nutrients, what we call the safe passage stack that we offer to our clients. So you'll get to learn how to use that strategically before a traumatic trip happens or if it starts happening. There are things that can completely turn that around. But psychological distress happening doesn't mean they're having a traumatic trip. It's a totally different thing. They're facing something that they need to face. That's going to be healing for them in the long run, but in the short term, they're very escalated. If the facilitator or guide overreacts, it can make it worse. The client's already escalated, so the guide or facilitator has to be very calm and reassuring and use your voice, your body language, your facial expressions to convey a sense of safety and compassion and relaxation. When you put out that kind of energy, that's what the client will pick up on, and that by itself helps a lot to start decreasing the psychological distress. This is a very important comment to keep in mind. All experiences will change and altered states will pass. What's going on in this experience is not going to last forever. The journey will change, and in a few hours it will end. Really important for you as a guide or facilitator, have that in mind and be well grounded in that truth. What you're experiencing is not forever. The journey will eventually change and will end in time. If they're connected enough to worry about their sanity, which some people are saying, I'm afraid I'm going crazy, I'm afraid I'm becoming psychotic, and they get very escalated about that. Remind them the state of mind that you're having, the emotions that you're experiencing are because you took a psychedelic, and it's a part of the psychedelic experience. And you're going to come back to your natural, normal state of mind over the next few hours or in the next little while. Tell them that it's normal for some people to go through emotional or existential crises in their psychedelic experience. And just like all the thousands of people before them, they will be fine. They just need to relax and let the substance run its course and remember where they are and what is happening. I like this picture here because the guide is giving a supportive touch, but not distracting the client from whatever they're dealing with. All things pass. The psychedelic experiences, as I said, has known phases. Each phase lasts for a set period of time, which is somewhat variable, but it's in a general range of time, and they will come out the other side. There's also ways that we can remind the client to navigate what's happening that will in fact cause it to change more quickly. Okay, on the other side of all of this, we have to give special attention to trauma clients around integration. So we want to be sure that we assess them afterwards, and we make sure that we have a client designed safety plan. It's very important that they choose their own elements of their safety plan because they are the one who will have to act on it if needed. Identify if additional support is needed, teach them methods for navigating uncertainty and anxiety, make sure they have a clearly defined support system and a holistic plan for self-care. They will need a well-structured but also flexible integration plan, and make sure that they engage in independent practices. So if they have somatic needs, then they should go to yoga or go hiking or be in nature or do movement, something like that. We work with an interdisciplinary team, so if you do not have that, you can create that by having a really good referral network. Maybe they need to see a different kind of specialist afterwards. So make sure that you have your referral network put together and ready to go. You need to provide, or rather the facilitator or guide needs to have tools to evaluate the client's integration process. There are several really good measures, and there's new ones coming out all the time, and we incorporate those into the training. And we're also one of the few programs that gives you that whole suite of all the forms, all the tools, the coaching methods, journals, and all these things that you're learning how to work with. You're going to take those away to start your practice. Depth coaching is very helpful for post administration session. Counseling can be beneficial, integration therapies, microdose protocols. And microdose protocols come in where the client maybe had 2 sessions and they're about 4 weeks later and they want to maintain their progress and have support to keep integrating the changes that they need to make and to avoid falling back into old patterns. And so we can put them on a microdose coaching program, microdose protocol, and it helps them keep going in the right direction. And then tuning in, assessing what's happening, and planning for additional full dose administration sessions as needed. The clinical research is showing that a course of treatment or a course of care for trauma recovery would be to have 1 session a month for 12 months. And I think it's good to start with the 2 standard sessions that they do in clinical research, and then engage your clients in ongoing programs, coaching programs or counseling, whatever your particular practice includes. And then keep in mind that they can continue to benefit and grow and heal by having additional sessions later. So that is the information that I have from the workshop. And Prema is going to put some links in the chat for you where you can explore and learn more. Bodhi Academy Psychedelic Facilitator Training is a 6-month intensive program, 150 classroom hours of highly specialized, highly detailed training, including live synchronous sessions with the faculty, the ability to join your members of your cohort to actually practice what you've learned, and then a very intensive 100-hour practicum that includes a 10-day in-person retreat where you actually practice the administration of psilocybin for individuals and groups in the legal state of Colorado using the actual natural mushroom. Our 2025 training program begins March 19th. And we have a special information session for professionals coming up at the TPN, the Trusted Professionals Network, tpn.health. Prema's going to put that link in the chat for you as well. And that's coming up on Tuesday, March 11th at 12 p.m. Central Time. You can also book a one-to-one call with me, and there's a link in there for that. I'd really love to meet you and learn more about your interests in psilocybin or being a guide. It's an amazing field that, is spreading throughout the country. We're seeing more and more states pass legal initiatives. I think there's currently 28 states that have some legislation pending around these initiatives. Whether you're in a legal state, a decriminalized environment, or a state where it's not legal yet, there are ways for you to have a psychedelic guide or a practice as a harm reduction specialist for psychedelics in any location. And we teach you how to do that too. But if you want to talk about how can you do this, what do you need to know in order to do it? What is your passion? What is your interest? I would really love to connect with you. Having community in this work of like-minded people is really important. So you can book a call with me at the link. We're also sharing the enrollment application link. So if you want to apply, we're getting close to the moment in which you need to get your application in. So please be sure to click on the link and submit your application when you're ready. Thank you so much for being with us today. And we'll look forward to seeing you. We have one more workshop coming up next week. And we also have that special information session, which is going to be pretty incredible too. And so I hope to see you then.